Hi, my name is Hannah Holt, registered nurse. This is my general survey and pathophysiology video for NUR 3140, Pathophysiology and Physical Assessment. I have with me today Kate Holt. Kate, do I have your permission to be filmed for this class?
Yes, you do.
Okay, and how would you like me to refer to you now for the rest of the video?
Kate works just fine.
Okay, so Kate, the first thing I'm going to do is a general survey, kind of what brought you in, go over some past medical history. Is that okay with you?
Yes.
Okay, so also before I begin, I'm just going to have you state your name, your date of birth, what month it is, what season, and who the president is, just to give us a sense of your orientation.
Okay. So Kate Holt. My date of birth is August 2nd, 1995. The season is winter. The current president is Barack Obama.
Okay.
And is there anything else?
What month?
December.
Fantastic. I'm also going to have you at this point, I'm going to point to some items in the room and just have you tell me what they are, okay? So this big thing back here?
Fireplace.
Correct. This?
A pen.
And this?
Stethoscope.
Perfect. And I'm also going to have you remember 3 items for me, okay? Just to get a sense of your ability to recall short-term memory. So the items, and then I'll ask you to repeat them later on when we're finished, okay? So the items are cat, plant, and window. Okay?
Okay.
All right, fantastic. So let's start the paperwork. All right, so what brings you in today?
I just recently moved, and this is my first time with this facility, so I wanted a general health checkup.
Okay, great. Is there anything else that's going on that you're concerned about?
I just, as I said, just moved. I don't really know anybody. I'm taking a break from school and trying to get over just some past issues that were left behind me when I moved.
Is the move making you anxious, or how do you feel about the move?
I think the move itself was good, but there's anxiety that came with it.
Okay, so you feel like you're currently experiencing some anxiety?
Yeah.
Okay, and is that new for you, or have you had experiences with anxiety in the past?
I've had experiences in the past, but I don't believe they were ever resolved.
Okay, so do you think that this might be a little bit of kind of a pattern?
Yeah.
Okay, so I'll finish the general survey, and then if you have any other questions about anxiety or depression, we can definitely talk about that later, okay?
Okay, thank you.
All right, so first of all, do you have any allergies?
I do not.
No allergies. Any drugs or seasonal allergies?
Mm-mm.
Okay, food allergies?
Nope.
Okay, fantastic. Any medications you take currently?
I do not.
Any supplementations or herbal alternative medications?
Not that I recall.
Okay, do you get acupuncture or massage or anything like that?
No.
Any tobacco use?
No.
Any alcohol use?
Mm-mm.
Any illicit drug use?
No.
Okay. Past medical history, anything in your childhood?
Yes, I had chickenpox as a child.
Okay, what year approximately was that?
Probably 1998.
Okay, fantastic. Any adult illnesses?
Yes, I had strep throat.
Okay, how long ago was that?
About a year and a half ago.
Okay. Any surgical history?
No.
Any mental health history?
Not personally.
Okay. But the anxiety you said was a little bit of a...
Yes, I suppose. Yes.
Okay, so some anxiety in the past.
Yeah.
When do you think that started?
Probably about middle school.
Middle school. Did you ever see anyone, any therapy?
No,
or anyone close to that you talked to about that?
Not really. I don't think I realized that's what I was experiencing.
Okay. So when did you start giving it a name?
This past year.
Okay. And you've never been medicated with anything for anxiety?
No.
All right. And how about any OBGYN history? Any problems with your menstruation, or
Not really, no.
any surgeries, any concerns, any abnormal pap smears or anything like that?
No.
Okay. All right. Did you have the flu vaccine this year?
Yes, I did.
Okay. Did you have the pneumonia vaccine?
I don't believe I did.
Okay. And how about tetanus?
Mm-mm.
All right. And all your childhood immunizations are up to date?
Yes.
Okay, fantastic. So do you have any cardiac history in your family? Any hypertension?
Hypertension, yes.
Okay.
My grandfather.
Okay. And is he still living?
No, he passed away last year.
Okay. Any diabetes?
Yes, my grandfather and grandmother.
Is that the same grandfather that passed away?
Yes.
Okay. Any cancer?
Yes, my grandmother had breast cancer.
Okay. Any suicide?
Not that I know of.
Okay. Any renal disease?
I don't
Any
believe so.
kidney disease?
Yes.
Okay. And who is that?
The grandfather.
Okay. Thyroid disease?
No.
Okay. Any history of stroke?
Yes, my mother.
Okay. Any substance abuse that you know of in your family?
Not that I know of.
Okay. And is this grandfather and grandmother, are they paternal or maternal? Were they on your father's side or your mother's side?
Paternal.
Okay. Okay, fantastic. So I know where your birthday was because you told me earlier, but where were you born exactly?
Mountain View, California.
Okay. And your education, what's your highest level of education at this point?
High school graduate.
Okay. Any college?
Yes, 2 years of college.
Okay. And what are you doing for a living right now?
I work as a barista at a cafe.
Okay. And your family situation, are you married, single?
I am single.
Okay, and where are you living?
I'm living, as in with whom?
Yes, with
Oh, okay. I'm living with my father.
Okay. And do you have anyone in your support system, any family and friends that you can rely on?
Yes.
Okay.
Yes.
And do you have any interests or hobbies?
Yeah, I read,
Okay.
watch movies, and draw.
And how about your diet? How often do you eat a meal?
I try to eat at least 2 meals a day.
2 meals?
I forget.
Okay, how's your fluid intake?
It's good.
Okay. How much water do you say you drink?
Not enough.
Okay. And how about exercise? How often do you exercise?
About 5 days a week.
Okay. And what kind of exercise is that?
It's a 30-minute walk to work and back, so 60 minutes.
Oh, okay. So 2 times a day, 5 days a week.
Mhm.
Okay, fantastic. All right. So, Kate, at this point, I'm going to ask you to recall those items I told you about earlier. Those 3 items.
It was plant, window, cat.
Okay, fantastic. So I'm also going to do a set of vital signs on you, okay, just to really start off our physical assessment, and then we can get right ahead to the physical assessment portion, okay? All right, so I'm going to do some hand hygiene here. A little bit of hand sanitizer. Okay, and you don't have any history of hypertension or anything, high blood pressure?
Not that I personally know of.
Okay, any respiratory symptoms?
No.
Do you feel short of breath when you walk, anything like that?
Not at all.
Okay. Do you have any other complaints? Anything you're concerned about, like your skin, hair, anything with your abdomen?
I've been having acid reflux recently.
Okay. Okay. Do you feel like it's something that you're eating?
I think I drink too much coffee.
Okay. All right. Anything with your with your abdomen? Any changes in your bowel movements?
No,
Any
not that I think.
No abdomen pain?
No.
Okay. You're going regularly?
Yes.
Okay. Fantastic. All right. So first I'm going to get your temperature. If you could just open your mouth and stick out your tongue for me. And then close your mouth. Okay. 98.0. All right. Check your pulse. This is your radial pulse. 86 beats per minute. And then I'm going to get your blood pressure. So if you could just roll that up. If not, that's fine.
We can try.
Might be a little bit tight. So I'm just going to get it nice and taut up here. So if you just open your arm up for me. So a normal blood pressure is between 90 and 120 for your systolic, which is the upper number, and around, I want to say 50 to 70 for the diastolic blood pressure, depending on how much you've exercised and your age. Okay. So you just put that in there. How many cups of coffee a day do you drink?
Since working at the cafe, probably 4 to 5.
Okay. And how big are those? Like large ones or small?
Medium
Medium.
ones.
Okay. Do you drink enough? I mean, no, you said don't think you drink too much, but water?
Typically, probably not.
Okay.
It's not something I'll drink before going to bed.
Okay. I'd recommend increasing your fluid intake. All right. So if you could just hold your arm nice and still for me, that's just perfect. Your blood pressure is 90 over 60. I'm just going to have you breathe normally, okay? I'm just going to check your respirations. And listen over your trachea as well. Okay. 18 respirations, which is pretty normal. 12 to 20 is the normal range. All right, so we will be getting changed, and then we will start the physical assessment of this physical assessment general survey video for, again, pathophysiology and physical